report. Their suggestions for Sydenham were that Chatham Kent Health Alliance and the LIN should plan the development of a facility in Wallaceburg to provide urgent care 12 to 16 hours a day, 7 days a week. And I'm going to tell you in a minute what urgent care means. They said that the two alternatives to be considered were close Sydenham Emergency Department and redirect all patients to Chatham, and the creation of a comprehensive primary care facility in Wallaceburg, either in the existing hospital or as a new construction project. That's what they said. We still got to get through what the Hay Group is saying, and then we're going to talk a little bit about what we think. So that's the more fun part of it. But we need to tell you what's going on as well, too. They also said that prior to any closure, the Chatham Kent Health Alliance should develop a comprehensive plan to ensure a viable emergency department at the Chatham site, which will provide services to residents of South Lambton, Wallaceburg, and Walpole Island First Nation. They also said the LIN should plan the development of a comprehensive primary care facility in Wallaceburg, which will include an urgent care center that would run 12 to 16 hours a day, 7 days a week. And as we're going to show you, urgent care, primary care, is not emergency services care. So we're going to talk a little about definitions so you know what these things are. Emergency care, obviously, is any person who has a significant illness or injury, especially if they cannot explain what is causing it, should head directly to the emergency room. Absolutely. Time is crucial in these circumstances. In cases where the heart and brain are involved, the faster people receive appropriate care, the better the chance there is to save the heart muscle and the brain tissue. Time is of the essence. We all know that. Here are good reasons to go to the emergency department. I'm not going to read them all. You know what basically they are. Chest pain, heart attacks, confusion, abdominal pain, poisoning, seizures, head trauma, all those good things. With what they're proposing, those are the good reasons to go to the emergency department. You'll be going to Chatham to get taken care of those kind of things. I don't think that's right. In comparison to 17 other rural hospitals across Ontario, those that see approximately 13,500 to 32,500 patients, Sydenham saw the second highest level of emergency cases. Second highest level. And they have the golden report to say that we don't have enough visits to justify. Okay, what they want to provide us is urgent and primary care. Remember, that's not emergency services. Urgent care is a medical problem in which your life...
Sorry, Jeff, but this is a lady that really has to get out. It's an Aurora 79T R61.
Okay, somebody with an Aurora 79T R61, you're blocking somebody else who needs to get out, please. We will not look to see who gets off and who walks out. Okay, so an urgent medical problem is one in which your life is not in danger, but you require immediate medical attention. An urgent care facility is not equipped to handle life-threatening situations, but typically handles instances that require immediate attention or delaying treatment could cause serious problems or discomfort. Let's go back up there just for a minute. An urgent care facility is not equipped to handle life-threatening situations. Examples of those urgent care situations: minor lacerations, objects in the eyes, earaches, migraine headaches, sprains, etc., etc. Urgent cases at Sydenham, in comparison with 17 other peer hospitals across Ontario, Sydenham saw the 6th highest level of urgent cases. 6th highest level. Once again, we're up there. Once again, the report says we don't have enough visits. I don't know. I think anybody who took elementary mathematics can probably figure this one out. As far as primary care is an important form of health access for patients. Primary care involves the widest scope of health care, including all ages of patients, patients of all social, economic, and geographic origins, and patients seeking to maintain optimal health in patients with multiple chronic diseases. And a primary care facility is ideally designed to provide services which don't necessarily need to be delivered in a hospital, but address the less urgent needs of a patient. Very important, very much a necessary part of healthcare, but it doesn't address emergency issues. Primary care is typically provided by family physicians and nurses, dietitians, mental health professionals, pharmacists, therapists, and others. Primary care includes the prevention, diagnosis, treatment, and follow-up of various health conditions. It also includes referrals to specialists and diagnostic services such as laboratory tests or x-rays. Through with these various definitions because you need to understand what emergency care is, you need to understand what urgent care is, and you need to understand what primary care is, because what this study is suggesting is that they're going to take away the emergency department, the emergency care, the emergency services, and if you have anything life-threatening or major trauma, you're going to have to be transported to Chatham to see a doctor. They're going to give us urgent care and they're going to give us primary care, but it's going to be set up such that it's going to be an operation anywhere from 12 to 16 hours a day, so you can't get emergency services there. They're going to be closed during the evening, so you're not going to have any kind of care there at all. So that's what they're proposing. That's what they suggested. So when you think of anything that's life-threatening, think that's what they're taking away from you here locally, so you have to go to Chatham to get that. The other thing I would suggest to you is that they take away the emergency room and they provide us with an urgent care and a primary care facility. I would honestly say to them, and to anybody who would ask that question, how long do you really think that those services would end up lasting in this community, because they've been slowly taking everything away from Sydenham, and I don't think it would be that much longer before they say, well, you know, we're going to take away the urgent care, and then we're going to take away the primary care, and then pretty soon there'll be nothing left in this community. You know, at the end of the day, trust is earned, and there is nobody involved with this process on the other side who has given us any reason to trust anything anybody has ever said. Okay, here's where we get into where, as they say, the rubber hits the road. This is what does no emergency department mean for Sydenham campus. You'll no longer be able to use the outpatient lab. There'll be no more admissions to Sydenham because all patients will have to be admitted to other facilities. You'll be unable to receive care, medical, nursing after hours, because they've even said that the urgent and primary care will be open from 12 to 16 hours. Well, when I look at 12 to 16 hours a day, that means they're either going to be open from 7 to 7 or 7 to 11. So you'll be going somewhere else either from 7 to 7 or 11 to 7. There's going to be longer waits in other ERs. There's going to be limited bed availability in other hospitals. And you're going to have to find transportation to those urban centers. You know, it's interesting because a letter was sent around that I wrote in 2003 dealing with the cutbacks to our hospital back then. And I remember that very clearly because the minister of the day, George Smitherman, met with us and the Save Our Sydenham committee right within the hospital. And we had a discussion with him. And at the end of the day, we were able to make some progress. George Smitherman is now the Deputy Premier. He's no longer the Minister of Health, but he's now the Deputy Premier. And it's interesting because I actually bumped into him about 6 months ago, and I reminded him about our meeting at Sydenham. And he said, yeah, he said, that worked out okay, didn't it? He said, you still got your hospital? And I said, yes, we do. So, first of all, I'm going to remind him of that conversation we had, but we're also going to put some pressure on the new Minister of Health, which is David Kaplan.
Hey, Jeff. Sergeant Pondy again. The Aurora movement, there's an Integra, same situation, and then we're good to go. Please.
Just, what kind of Integra? There might be a couple of them out there.
Well, they didn't say, and they're ready to call a tow truck, so... Okay,
all you people with Integra, better get out there and move your car. I don't know if it's yours or not, but you better get going.